with members of Congress in both parties to make sure that we construct the kind of economic support that will allow those industries to weather the period of the coronavirus and then to come back stronger than ever before.
We've had such incredible, I don't know, it's almost the word spirit is the best word. It's like a spirit. The banks have come in and the banks are doing things that they would have never done. They're working on extensions and lots of things that they wouldn't have done. Co-pays with regard to the insurance companies. I mean, for them to be doing what they're doing, you know all about the co-pays. They would have never done that, and they did it. They were in my office. They, I would say, the 11 biggest in this country. I guess probably the 11 biggest of the world. The big ones, all the big ones, and they did things on copay that nobody would be doing, that they wouldn't have done in a million years, but they're doing it. There's a great spirit going on right now in the country. So you want to, yes, please.
Dr. Fauci, you said you like being accused of overreacting because that is an indication we may be doing things necessary to beat this, bend the curve. How long do you think it will take for you to be confident that yes, we're bending the curve, or no, we're not?
You know, I can't give you a firm number on that because the dynamics of outbreaks in some respects are predictable historically. They do this and that. We don't know because this is really unprecedented. I mean, of all the outbreaks that I've been involved with over the last at least 36 years and then going historically back, we've never had a situation where the mobilization of all the different components, travel restrictions, internal containment, mitigation, financial assistance, public health assistance, testing. So we don't really know. But the one thing I do know that if you look at models with all of their vicissitudes of models, is that when you have input into the kinds of mitigations and things that we're doing, we're going to see a hump instead of a peak. I would be really surprised if all the things that we're doing, and this is really a comprehensive approach. I was struck as I was listening to everyone make their presentations that, you know, I'm a scientist, I'm a health person, and I'm a physician who sees patients. So I look at it from one particular standpoint. But what I'm being impressed by is that this is really a comprehensive thing that has multiple components to it. All of them got to succeed if we're going to get to that end point that I've described multiple times.
Millions of tests have been sent out. So why have fewer than 60,000 people actually been tested?
I think you will see different numbers this week. You heard just of 8,000. Remember, all of these tests, the high-speed tests, were approved last Friday night, and last Thursday night. I think if I could talk to Thermo Fisher and the other groups that have these platforms out there, do not rely on a pull technology push out those tests. Because we can only make them available, groups have to order them. So we've been talking to Thermo Fisher, one of the key platforms, to push out tests based on need and not wait for
It's a
That's a great question. I know part of it is getting the test out right now. I think the Admiral and others are working on getting the
2 weeks and the amount of $1,000, that's a possibility there, and that's just to provide some relief there. Also, despite the roller coaster ride, they're also saying that the markets will stay open. I believe we have the signal back. All right, let's listen in.
Patients with mild to no symptoms. So what does that say about the impact of testing, and does it mean that testing should actually go beyond the sickest patients?
You know,